Hello, it's Thursday, March 2nd, 2023. It's Dr. Rhonda Johnson, and today I'm talking about the mask debate. It just keeps on continuing, folks. The whole question, do masks work? Well, it's hard for me to believe that, we're March 2020, March 2021, March 2022, March 2023. We're 4 years into this pandemic, and people are still talking about do masks work? Well, there was a study, if you follow COVID news and literature, there was a study, the recent Cochrane Report. Now, the Cochrane Report is a highly respected, considered by many to be the gold standard of evidence-based medicine. They published a report on February 21st, which showed masks are not effective in the community setting or in healthcare settings. Now, they did meta-analysis comparing medical surgical masks versus no masks to prevent the spread of respiratory illness in healthcare workers and in the community. Now, they looked at influenza as well as COVID-19. So many experts have picked apart this finding. They've questioned the methodology, they've questioned their conclusions. Some experts say it was a flawed approach, looking at masking over many different community settings with different diseases. I'm not a health services researcher, but what's challenging for me is there's so many studies that do show the benefit of masks. They've shown them in schools, they've shown them in the community, they've shown them in healthcare settings. So, the bottom line is, it's clear one thing, that the debate will continue. To be scientific, it seems as if the evidence is mixed and people will fall into kind of either or. Those who support masks will support the science that shows wearing them is effective. Those who don't support masks will support the science that says they don't work. Now, the reality is very few people wear masks, and no one is making you wear them either, except for in healthcare settings. So if you're on the fence, you may want to wear masks during high community transmission levels, particularly when you're in crowded indoor places with poor ventilation. If you're immunocompromised, if you're 65 years or older, or have chronic medical conditions, you may want to think about wearing the mask. I know I will be wearing masks. That's just my opinion and my practice when I'm indoors in those public settings. I will also do my best to have fresh air moving around and use a HEPA air filter whenever I can, because we do know, and that's clear, that these viruses are airborne. So that's my message today. Just maybe next year I won't be talking about this again. Who knows? Take care, folks. And if you want to wear your masks, wear them. I'll be wearing mine. All right, take care.